I'm Fred Schreuder. I'm a consultant plastic surgeon. I do the entire gamut of plastic surgery and I have a special interest in hand surgery as well. Breast augmentation is surgery that uses silicone implants to enlarge a woman's breast. The implants are placed underneath a woman's existing breast tissue and enhance and enlarge the appearance of the breasts. I like to explain to patients that during a consultation, breast augmentation is not merely about an operation, it's more of a journey, and I have to explain to the patient what the entire process is going to involve. The consultation involves taking a comprehensive medical history because the operation is performed under a general anaesthetic and patients need to be fit for a general anaesthetic. There will also be questions specifically related to the breasts, looking at things like breast lumps and family history of breast cancer, which are very important for women considering this type of surgery. After the history, the patient will have a full examination of the breasts with a nurse chaperone present. Thereafter, we'll discuss whether breast augmentation surgery is appropriate for the patient and whether additional procedures such as uplift or mastopexy procedures are required at the same operation. There generally is a wait between consultation and surgery. The cosmetic industry is regulated and there's a 2-week cooling off period. I like to see patients at least twice before a breast augmentation operation. One for the initial consultation to discuss the procedure and assess the patient's suitability, and then a second consultation perhaps to look at some before and after photographs and also to discuss sizing of the implants. So yes, there is usually a wait between the consultation and surgery. It's to give the patient a cooling off period. Breast augmentation surgery enlarges the breasts, and in general this gives a larger, fuller breast with an enhanced appearance, and the appearance is fuller and more youthful looking. I see patients across the entire spectrum of ages. The majority of the patients that I see are women in their 30s and 40s who've had families, and I think that's probably the most sensible age to consider breast augmentation surgery. I also see women in their 50s who've never had breast augments before, and younger women. And the one thing I do say to younger women is make sure that your breast size has been static for 18 months before you consider a breast augmentation operation. During surgery, which is performed under a general anaesthetic, the patient is on an operating table. They'll be given a dose of antibiotics prior to surgery. I make a 5-centimetre incision or cut in the fold underneath the breast and then use sizes to adjust and work out what size implant is going to be the best for the patient. The table in theatre can also be adjusted just so we can see what the effects of gravity will be on the breast. After the operation, the patient is stitched up and then placed into a support bra, which they pretty much wear day and night for 6 weeks after surgery. I say to patients that the recovery time is approximately 2 weeks. So I advise patients to take 2 weeks off work. Often the first week is the most difficult, so they may require additional support at home, particularly if there are children involved. It may be 6 weeks before you can get back to doing exercise, and for certain people who are involved in more manual or higher physical jobs, the time off work may be up to 6 weeks. In general, because this is a cosmetic procedure, breast augmentation patients come and see me without needing to go and see their GP. If they want to see and discuss it with their GP, of course they're willing to do that. It's not a procedure that the insurance companies fund, so I don't tend to see patients that are directed by an insurance company.